If not, oh, cool.
Yeah, Stacy. Sarah's not here, but I am, Robin.
Oh, hey, Stacy.
Hi.
Thanks for joining us. In terms of recreation, obviously we're in the heat of summer with our outdoor pools and indoor pools. Summer camps are happening. And we actually, for the first time this year, offered a senior camp. Actually 3, right, Sarah or Stacy? We had 3?
We have 3 1 weeks. Unfortunately, this week was canceled, but we already have 20 for next week.
Oh, awesome. So it's a new opportunity for our seniors to enjoy a different activity each day and visit different facilities and learn something new. So it was the first time we did it. Went pretty well, I think, for the most part. We hope to continue and expand it next year. For us, most of our buildings are up and running. We have a few that are on a limited schedule just due to some staffing shortages. We're still down about 20 merit positions that we're recruiting and training and trying to bring on more folks right now. I think like everybody in the world at amusement parks and things that you've heard on the news, we're struggling also with hiring seasonal staff, which is sort of the backbone of a lot of what we do. And so we've been struggling trying to get our buildings open fully, but we're hopefully by August 15th, we'll be well on our way. We have most of our holiday park is open fully now. We hope to restore Schweinhout August, Stacy jump in, August 16th or thereabouts.
Yes.
They've been running on Saturdays, which I've been over there a few times, and the folks there are really loving being back together again. And the rest of our buildings, we hope will sort of phase back in and open all of them back up, with the exception of Long Branch, which remains a homeless shelter all the way through, and Caulfield, all the way through the beginning of next year. We have done some programming at the library 2 days a week and are hoping to expand that fully. Also, either there at the library or transporting seniors up to Wheaton or Margaret Schweinhout when that building opens. We have Senior Olympics just around the corner. I think throwing off, kicking off, running off starting in August with a wide variety of activities. And if you've not heard about Senior Olympics, I hope you learn about it, because it's pretty exciting to see seniors getting out running, swimming, biking, hiking, bocce, you name it, they do pretty much everything. It's a pretty exciting opportunity. And Stacy, am I forgetting anything else that we're doing? I think some of the things I don't always talk about is we have a pretty vibrant senior population that plays adult sports. Probably our biggest component is of soccer, believe it or not, is men's over 45, 55, 65 playing soccer. Pretty remarkable, pretty cool. And the same with adult softball. We have a pretty vibrant program in adult softball, which is over 55 as well. Stacy, did I miss anything that we should cover also?
I just wanted to mention with the other senior centers, so in addition to Holiday Park and Damascus being 5 days a week, North Potomac, White Oak, and Wheaton are all 2 or 3 days a week. But come August 2nd, we'll be going to 5 days. So we'll start to see an increase in the service days at each of those centers, really here in a matter of weeks. So we're gearing up for that. And of course, as Robin already mentioned, with Schweinhout on the 16th.
And all of us in county services are starting to kick off. I can't believe I'm saying this, the next budget cycle for FY. We just started this fiscal year. Now we're already planning for the next. So it's good to be back doing recreation work and not COVID testing and vaccine. So I think that wraps it up for us. Patrice, if you want to jump in.
Sure. Thank you, Robin. I appreciate that. So in the interest of time, I do want to do a quick round robin of introductions, and then I want to introduce our speaker. So I will call the names that I see on the screen and go from there. Marcia?
Hi, I'm Marcia Pruzan. I'm Senior Fellow with Aging and Disability Services, and I manage the Age Friendly program, which most of you know.
Carla? Carla, are you your audio? Can't hear you.
Hi, can you guys hear me?
Yeah, barely, but yeah.
My name is Carla. I'm a summarized student with Miss John.
Welcome, Carla.
Excellent, welcome, thank you. And Stacy? Everyone
Hey,
knows Stacy.
Hey, everybody. I think I'm the only Stacy. Stacy with Recreation Supervisor on the Senior Programs team. Thanks for having me today.
Thanks. Nicole?
Good afternoon, everyone. I'm Nicole Charles. I'm the new Executive Director at Senior Connection of Montgomery County.
Excellent, welcome. Stuart?
Hi, I publish the Beacon newspaper and I'm chair of the Communications Committee.
Beth? Beth, you're on mute.
Beth or Betty?
Beth. Welcome to Betty.
Actually, I think that's Jim Resnick.
Okay. Jim?
I can't figure out who I am.
Oh.
Yeah, for some reason, it shows up as Beth Resnick, but I'm not.
It does,
Jim
yes.
Resnick from Montgomery County Fire Rescue Service, Senior Outreach and Education.
Excellent, thank you. Jim?
And I'll change my name as soon as I get home.
Okay, thank you. Jim?
Hi, everyone. I'm Jim McClelland with the county's Office of Emergency Management and Homeland Security.
Excellent. Betty?
Betty Rings, Senior Fellow with Councilman Katz in District 3 for the Montgomery County.
Chuck?
Chuck Kaufman, Chairman of the Commission on Aging Alumni Group, Visit Montgomery, Taxi Cab Services Commission, and I'm on the Transportation and Communication Committee.
Excellent, thank you. Burke?
Okay, that's you. Okay,
Burke? Sorry, said that wrong.
it's okay. You're muted. It's gonna be the shirt of the year. You're muted or we want to mute you. I'm not sure of which. Can you mute one way or the other? We can't. I'll help Burke. That's Burke, the Director of Office of Human Resources.
I am so sorry. I've been just trying to get off the mute. Robin, thank you. Berke Atilla, Director of Human Resources for Montgomery County. Apologies. Been trying to get off mute, and I provided my own bingo, so now I'm part of it.
Excellent. Yeah, technology. It's so much fun. Eddie?
Eddie Rivas, Vice Chair, Commission on Aging.
Excellent. Janine?
Hi, Janine Tersini, and I run the nonprofit Arts for the Aging.
Lorraine?
Hi there, Lorraine Driscoll. I'm Public Information Officer for Department of Housing and Community Affairs.
Mara?
Mara Mayer, and I am co-chair of the Age-Friendly Employment Work Group.
And Vivian?
Vivian Shea, I'm co-chairing the Civic Engagement Group.
Sean?
Hi, Sean Brenner with Aging and Disability Services. Thanks for everyone for making the RISE students, Carla and Kiara, feel comfortable, and for welcoming Nicole Charles from the Senior Connection. Thrilled to see her here.
Glad to be here.
Dina?
Hello, good afternoon, everyone. I'm Dina Rivera with the State's Attorney's Office. I'm a legal assistant with the Crimes Against Seniors and Vulnerable Adults Unit.
Thank you. Patrick?
Patrick Fleming with the Montgomery County Office of Emergency Management, Homeland Security.
Lily?
Hi, I'm Lily Fisher with the county's Area Agency on Aging, and I also am the chair of the Age-Friendly Home and Community-Based Services Work Group.
Sam?
Hi, Sam Aji, Department of Transportation.
Tracy? Tracy, you're on mute. Okay, I'm going to jump over to Kiara. Maybe Tracy's having technical difficulties. Kiara, are you there?
Are you talking to me?
Yes.
Okay. My name's Kiara Pierce. I'm with the Summarize program. I'm going into 11th grade, and I'm happy to be here.
Welcome. Thank you for joining us. And it looks like Dr. Krall is joining. Are you connected, Dr. Krall? Don't see you on the screen yet. Howard, if you would, you're on the screen.
Okay,
Oh,
hi,
there
everybody.
we are.
Yes, there you go.
Okay, do you want me to get started?
Actually, no, I'm going to do an introduction, Howard.
Okay, sure.
Give me one moment. The screen jumped around on me, so sorry for that.
Not a problem.
Dr. Krall, I want to turn it over to you real quick, since I just saw you join. Are you connected?
I am, but I have but I seem to have a terrible echo.
That's me.
Patrice, I don't think Raymond's going to be able to do it with the echo.
Right.
It looks like Dr. Kroll is connected with two mechanisms, two devices.
Yes. So in the interest of time, while Dr. Krall is getting connected, I am going to go ahead and provide an introduction for our speaker. This afternoon, we are pleased to have Howard Gleckman, who is a senior fellow at the Urban Institute in Washington, D.C., where he is affiliated with both the Tax Policy Center and the Program on Retirement Policy. He's the author of Caring for Our Parents, St. Martin's Press, and writes a weekly column on aging issues for Forbes.com. Mr. Gleckman served on the National Academy of Social Insurance Study Panel on Long-Term Services and Supports between 2018 and 2019. He was a convener of the Long-Term Care Financing Collaborative between 2012 and 2016. He was 2006 to 2007 Media Fellow at the Kaiser Family Foundation and a 2006 to 2008 Visiting Fellow at the Center for Retirement Research at Boston College. He was Senior Correspondent in the Washington Bureau of Business Week, where he covered health and elder care, as well as tax and budget issues for nearly 20 years. In 2016, he was named one of the nation's top 50 influencers in aging by Next Avenue. He was a 2003 National Magazine Award finalist for The Coming Revolution in Healthcare for Business Week. Additionally, Mr. Gleckman is president of the Jewish Council for the Aging of Greater Washington, a member of the Johns Hopkins Health System's National Capital Region Executive Governance Committee, and a trustee of the Johns Hopkins Medicine Patient Safety and Quality Committee. He previously served as chair of the Board of Trustees of Suburban Hospital in Bethesda, Maryland, and as a trustee of Johns Hopkins Medicine between 2017 to 2019. As I turn it over to Mr. Gleckman, should you have any questions throughout this presentation, I ask that you please drop them in the chat and we will make sure we have time for questions. Turn it over to you, Mr. Gleckman.
Dr. McGee, thanks very much. It's great to be with all of you, see some old friends, and also see a number of people who I know by reputation but have not had a chance to meet. So hello to all of you. What I'm going to do is talk a little bit about some of the policy issues, some of the broad national policy issues that are confronting all of us who are interested in aging issues. And I guess I have to do the usual disclaimer. Whatever I say is my own opinion. It's not the opinion of the Urban Institute or JCA or Johns Hopkins. And I want to start by saying that, we can't really think of aging services today without thinking about COVID. As you all know, 500,000 older adults died from COVID-19, which is almost 80% of all those killed by the disease. We focus on those who died in long-term care facilities because they were so visible and they were relatively easy to count once the government required facilities to disclose numbers of cases and deaths. But remember that at least as many of those older adults who died were living in their own homes So this was not just a nursing home problem. And I think we do ourselves a disservice if we talk about it that way. And it's also important to remember that millions more suffered from loneliness and social isolation during the pandemic, some of which was a result of intentional choices made by government that had a difficult job of balancing between COVID risks and the real dangers of social isolation. COVID has in important ways changed everything. I'm not a guy who normally says things will never be the same, but I think after COVID, things will never be the same. And it's generated an extraordinary policy debate over caring for older adults, which is unlike anything I've ever seen in the years that I've been doing this. Before I get to that, I want to do just a little bit of level setting. This is familiar, I think, to most of you, but I think it's always useful to just throw out some numbers. So there are 12 million people of all ages who currently need long-term supports and services in the US. And that number is going to double over the next couple of decades. 2/3 of those 65 and older are going to need a high enough level of care that they would trigger long-term care insurance benefits if they had insurance, or they become eligible for Medicaid LTSS if they qualified financially. It's 2/3. For men, they'll need that care for an average of 2 years. Women will need that high level of care for an average of 3. But it's also dangerous to look at the averages. About 1 in 7 older adults will need this care for 5 years or more. Those are mostly people suffering from dementia, but some other diseases as well. So let's talk about some of the reforms that are out there that I think are going to really drive a lot of the discussion over the next year or so. Nursing homes, of course, have gotten most of the attention. Death rates, not just the numbers, but the percentage of deaths have been extremely high. And we know that there are nearly 170,000 excess deaths in nursing homes over 2020. That means that 170,000 people more died in nursing homes than were expected to die. And that was a 30% increase in nursing home deaths compared to 2019. Same time, nursing homes are under enormous financial pressure. Their costs are rising, labor costs. I can't talk to an operator of a nursing home or assisted living facility without the conversation going to, what am I going to do? I can't find staff. Robin was talking about this with her programs, but it's true across the board. So labor costs are rising, PPE costs are rising, and many facilities are going to have to be recapitalized. They're going to need major internal redesign in order to manage the infection control issues that were so obvious during COVID. At the same time that their costs are going up, their revenues are going down. Even pre-COVID, the revenues for post-acute care, which is really where their profits are, were declining. And that was for a couple of reasons. One of them was the rise of Medicare managed care. Medicare Advantage plans now represent over 40% of the Medicare population. And when you're a nursing home and you contract with a Medicare Advantage plan, you're doing it at a daily rate that's about 20% lower than if you're contracting with traditional Medicare. So revenues are going down for that reason. And the other reason is volume is going down. More people are getting post-acute care, post-hospitalization rehab at home rather than in nursing facilities. The result of all this is that many facilities are failing. Even the industry estimates that unless they get an infusion of revenue or business returns to what it was before COVID, as many as half of long-term care facilities will fail. Many of those that fail, unfortunately, will be not-for-profits. One of the big Catholic chains, Bon Secours, announced a couple of weeks ago that it's closing all of its senior living in 3 states. We're also going to see, I think, a major wave of consolidation. A lot of the for-profits, the private equity firms that own a lot of these facilities that you've heard so much about will be buying a lot of others at pennies on the dollar. And it's going to be very interesting to see what happens to them. The other thing that's happening is a lot of companies that were in the nursing home or assisted living business are now getting into the home care and hospice business. They see where the market is going and they want to get ahead of it. And that's going to create some very interesting dynamics, including, I think, a real threat to local home care agencies. It's be interesting to see what happens there. As I said, everybody is suffering from labor shortages. That's going to drive up the cost of direct care workers. A good thing for the direct care workers who are terribly underpaid, but a real challenge for the payers. And that includes, of course, families. Nursing homes are saying they need more money for Medicare and Medicaid. The big question is going to be whether policymakers try to tie those payments to better quality. And if they do, the question is, how are they going to measure quality? We often don't do a very good job of that. We tend to take the quality measures we use for hospitals and try to graft them onto long-term care, and it doesn't always work very well. At the same time, there's going to be growing interest in home care. It's important to remember that 80% of long-term care is already being provided in people's homes. So it's not as if we're going to make this major change from institutional-based care to home care. It's already happened, but it's going to accelerate. I estimate that about 80% of care already happens in people's homes. So we're going to do this increasing shift to home and community-based care, which tracks the desires of people's needs, but it raises a number of issues. First one is there are a lot of people who would like to live at home, but who can't. And we have to recognize that there are some people who, because of the nature of their illness or because of the absence of family caregivers, are going to need some sort of facility-based care. And we need to think about what that care is going to look like. Then there's a question about how we're going to pay for this. So about half of people who require long-term supports and services are getting Medicaid, but about half are not. For those people who are, the Congress has already approved a 10% increase in Medicaid HCBS, Medicaid Home and Community-Based Services, in the American Rescue Plan, which passed in March. That's worth about $12 billion to states. President Biden has proposed to increase the federal payment for HCBS by another $400 billion over 8 years. That would be an extraordinary increase, by far the biggest increase in Medicaid long-term care since the program was created in 1965. That's part of what Biden called the American Families Plan. It's likely to be included in what's coming to be called the reconciliation bill. This is the Democrats' only bill that's probably going to pass sometime later this year. Frankly, I don't think when all is said and done, we're going to see a $400 billion increase in Medicaid home and community-based services, but I wouldn't be surprised if we didn't see something like a $200 billion increase, which would still be quite extraordinary. It's important to remember, though, even though it's a lot of money, there's going to be a lot of pressure and a lot of conflict over where to spend it. And when you think about it, the money can go to one of three places. It can go to higher pay for direct care workers. It can mean more benefits for current enrollees, or it can expand the number of people who are eligible for Medicaid HCBS. The problem, of course, is with a finite amount of money, the more you spend for one of those things, the less money you have for the other two. So it's going to create a lot of conflict in the states over exactly how to spend that money. We don't know what Maryland's going to do with the money. We're still waiting to hear. The state legislature has put some tight constraints on how it can be spent. Mostly requires Maryland to either reduce its waiting list, and I have to say that Maryland's waiting lists for HCBS are notorious. They're some of the worst in the country. Or it'll have to be used to increase provider payments. Then the question is, will any of it filter down to the county? And if it does, what's the county going to do with it? It's also important to remember that as ambitious as Biden's proposals are, we also have to think about those people who are not eligible for Medicaid, those people who are never going to become so impoverished that they'll be eligible for Medicaid, but they still can't afford care. They don't have enough savings. They don't have private long-term care insurance. What are we going to do for them? And we also have to remember that if Medicaid increases its payment for direct care workers, the cost of the private market's also going to increase. So families who already can't afford home care that they need for their loved ones are going to have to pay even more. And where are they going to get the money? So one option is public long-term care insurance. Washington State has enacted a bill. A number of other states, including California, Minnesota, Illinois, and Michigan, are all looking at this. I've had some conversations with some people in the Maryland legislature. They haven't really gone anywhere yet. And there's now federal legislation to create a public long-term care insurance program that would supplement private insurance and private savings. It's also important to remember that you can't just increase Medicaid funding for home care itself, for direct care workers. You need an infrastructure to make home care work. You need transportation, you need meals, you need adult day, you need case management, you need medical screenings, you need caregiver training, and most importantly, you need safe and appropriate housing. You can't expect people to live at home if they don't have any place appropriate to live. In many places, the delivery of these services is not as well coordinated as it should be. And one of the things I think that we all need to work on, including in the county, is to find better ways to coordinate these different revenue streams so that we can really provide the services that people need in one easy way to achieve it. That's always tough. It's especially tough when people are fighting for dollars at times when revenues are tight. But I think it's critically important that we find ways to better integrate these services because it's so confusing for the families. I want to talk a little bit about Montgomery County, and this may not be popular with this audience, but I think it's important to say. It's great that we have an age-friendly designation, but the county really does need to do more. Personally, I will tell you, I'm very disappointed that the county's been so slow to reopen the senior centers. Robin, I know that you've had to deal with conflicting demands for those facilities, and that's not easy. But I just implore you that this issue of social isolation has been just terrible. And the sooner we can get seniors back in the centers and get them active again, the better. So it's great to hear that you can be reopening in August. I wish you could have said you were reopening in May. The other issue that I think the county could have done a better job with is the vaccines for homebound seniors. I think we were unfortunately too slow in responding to that need. I was talking to people, for example, in Corpus Christi, Texas, that had figured out a way to do this as early as last February. And it was really unfortunate that it took us as long as it did. Again, I'm glad we have the program stood up and I'm glad we're helping seniors, but we need to be more aggressive. I really do think that. I think we also need to think about, in a very broad way, how we could substitute for the declining numbers of caregivers relative to those who need care. And I'll throw a couple of numbers at you to give a sense of this. In 2010, there were 7 people of caregiving age for each person who needed care. That's each person over age 80. In 2030, just 6 years from now, or 7 years from now, I guess, there'll be 4 people, and in 2050, there'll be 3. On top of this, we have a big change in family structure. 25% of older adults live alone. Half of women 75 and older live alone. Fewer women are married. There are more divorces in later life. And of course, they outlive their husbands. That's a trend that's been going on for quite a long time. As a result, many of us will live to old age. And we're going to have fewer family members available to care for us. But I also want to say that, this isn't all bad news. Every time I give one of these talks, people say it's so depressing. But I think it's important to remember that the challenges of a growing population of older adults really stem from an extraordinary improvement in life expectancy. We're living longer than at any time in human history. From 1950 to 2019, life expectancy just at age 65 increased from less than 14 years to more than 19 years. It's an amazing increase. Now, COVID lowered that, at least temporarily, but the overall trend, I think, remains positive. And this is happening thanks to improvements in public health and medical technology. Just one example, between 1989 and 2015, the mortality rate for women with breast cancer dropped by 40%. Breast cancer went for most women from being a terminal disease to being a chronic disease. And that's wonderful news, but it's created a couple of problems. One of them is our health system has not yet adjusted to its focus from acute care to chronic disease. It's a very different model, and our health systems don't really understand that yet. And the second problem is our ability to care for people living many years in old age lags our ability to keep them alive. We can fix this problem, but we are running out of time. In just 4 years, the oldest of baby boomers will turn 80. And that's the age at which people really begin to need help. The numbers you always hear about 10,000 baby boomers are turning 65 every month. That's not important. 65, your health condition not very different than it is when you're 55. But when you're 80, that's when chronic conditions really begin to take effect, particularly diseases like dementia. And that means we just have a few years left. The oldest baby boomers are going to turn 80 in just 4 years. So we need to really think about that. So I just want to end again with a call to action from you all. The challenges for doing all this are tremendous, but thanks to this group and other groups in Montgomery County, we're starting to think very creatively about how to meet them. And I thank you for that. And if there's anything I can do to help you as you do that, please let me know. And I'm happy to answer some questions. I wanted to leave some time for questions, so I hope we can have a good conversation.
Certainly. Thank you, Mr. Glickman, for that information that you shared, the presentation that you brought forth. If there's any questions from the group, please feel free to. Mara has her hand up.
Yeah, I thought the report that you attached was heart-stoppingly wonderful and profound. My question is, who is it going to? Who are going to get these recommendations that are so thoughtful and critical for our survival?
So these recommendations will go to members of Congress. They're going to people in the Biden administration. Policymakers are seeing them. The question is, what are they going to do about them? We've got a lot of interest in some, others less so. The big challenge, I think, for politicians these days when they look at these recommendations is they sound great, how are we going to pay for them? And that's always a struggle, and it's hard to come up with a good answer for that, you know. But that's the sticking point. It's not the substance of the recommendations or even the recognition of the problem. COVID did a lot to help people recognize the problem. The trouble is how we're gonna pay for it.
I have a question from Eddie, and then we'll go to Vivian.
Howard, given what you know and understand about villages, the whole neighbor to neighbor concept at the local level, what would you say to villages as far as how to make their impact more seriously taken by the HCBS networks across the country?
So it's a really good question. Villages are a very important piece of this. I was talking before about how we need to find substitutes for families. And to me, two of the most important are villages and faith communities. The village movement here is much more robust than it is in most of the rest of the country. I think we have more villages than any metropolitan area in the country. San Francisco has a lot, but I think we probably have the most. The problem with villages is twofold. One of them is there are many different models of villages, and they are very dependent on what the local community wants, which is really good. But I think we've discovered that some of the models work better than others, and I think we need to do a better job of providing the technical assistance to those villages so they can do a better job. The other issue is across the country, villages have been working quite well for highly educated, upper middle class white people. The failure of villages has been to find a way to take this model and bring it to communities of color, lower income communities. I was talking to a guy just the other day who was beginning to seed villages in Hispanic communities in Florida and in California. But that, as far as I know, is a unique model. I think in the DC metropolitan area, there's one faith community village, which is largely African-American in DC. But it's been a real problem. And part of the challenge is we don't really understand why. I think we need to do a lot more learning about why it is that this model is taking hold in certain communities and not taking hold in others. But until it's more widely adopted, it's only going to be a kind of a niche resource, an important one, but a niche resource.
And part of it from the communities of color perspective is the traditional, you know, taking care of our own in our own communities, even though that has changed a lot. But the good thing is Montgomery County is going to be launching an AmeriCorps volunteer to try to look at the promotora models of Texas and California, the Southwest, and try to bring it here to Montgomery County for the Latino community in Long Branch in that area. So we're trying to make little steps bit by bit, but good, thank you.
It's an interesting tension, right? Because on one hand, the value of the villages has been, it's just the fact that it's a grassroots organization, a community organization. You don't want to lose that. And one of the things I fear if the government gets more involved in this is government involvement is going to come with strings. And that's going to take away some of that grassrootsness that makes the villages as important as they are. So I think what we need to do is find a way to balance this, provide the government support, but without constraining what people and communities really want to do. And that's not going to be easy. But I'm glad to hear that Montgomery County is looking at ways to stand these up in some other communities. You can't say, this is a class exam, you can't say, I'm here from the government, I'm here to help you, and I'm going to tell you how you're going to create your village.
Right.
That'll never work.
Right.
So we need to find that balance.
Yeah. Thanks.
Sure.
We have Vivian, and then we'll go to Austin.
Yes. Actually, what I'm thinking is that there's a lot of things that the government should do, but I feel that there's a lot of improvement the county should be doing. I mean, recently I had a pretty bad experience, and I've been waiting to hear from social services for 4 days. All I get is a voicemail. I mean, many of you have never personally, encounter, interfacing with the real worker, I guess. Okay. I mean, we're talking about a lot of big pictures, but because I was trying to help someone to ask certain question about Medicaid because that person was rejected. So I called the caseworker. It's been 4 days now. All I get is a voicemail. I call every day. So I feel that this is a things that I think many of the people, the seniors that would like certain answer have encountered the same thing. So I think that these are small things that we should be doing in the county first. Okay, I mean, the government can do all these big things, get money and, assign, but I think that there's certain things that we can do. I don't know who I should be talking to. I tried to write to Odile, but I guess Odile is right now on vacation. But I think that we need to improve a lot in those kind of area. Customer service, okay. That's all I have.
I do want to say, Vivian, that particular correspondence you're speaking of, I will talk to you offline about that. I am working on it.
All right. Thank you.
Excellent. And Austin?
Yeah, I just want to say, I thought the talk that you gave, Howard, was brilliant. And you hit all the right points. A couple of things. Number one, it seems to me that aging in Montgomery County needs to have a higher priority than it currently has. And that's a mistake for the data you're just citing about the growing numbers of baby boomers who will be just around the corner. I wondered if one possible thing that could be done is a little bit more on tax relief for older adults as a Maryland and county initiative. There are tax reliefs. There are currently things, but I wondered if that would not help, number one. And number two, on the long-term care, I would think that perhaps if we just added a few dollars a day to the Social Security payments when we turn 21, by the time we get old enough, there'd be a little bit more money for that purpose.
Austin, it's good to hear from you. I'll leave the question about raising taxes to somebody else. But as far as the public long-term care insurance program, you're exactly right. We designed the long-term care collaborative that I worked on, designed a program that would provide a lifetime benefit of $100 a day in cash after somebody needed care for a couple of years. So they'd be responsible for their care for the first couple of years. And then after that, they'd get $100 a day for life. We calculated that proposal would require an increase in payroll taxes of about 0.6%. And for somebody making the median wage, that would be a payroll tax increase of about $250 a year. So it would be remarkably inexpensive. And for that, you would get a very important Social Security-like social insurance backstop if you needed it. So you're right, we could do this, it would be cheap. Congressman Tom Suozzi from Long Island has proposed a very similar bill. They did an analysis, the cost is essentially the same, $250, $300 a year for everybody who's working. Question is, back to what I said before, we've got all these politicians who look at it and say, interesting idea, but I don't want to raise taxes. So we have to confront that. But you're right, we could do it.
Thank you.
I have a few comments in the chat I want to highlight. First one says, way to go, Aviv and HHS for enlisting a volunteer Maryland AmeriCorps to work on this important issue for the county. Then we have additional comment. It says Montgomery County is lucky to have Fazit working on our behalf. So thank you for the comment towards Fazit. I ditto, I agree. Any other questions?
And just for context, it's very unusual for a county to have a village coordinator like Fazit. So I was complaining before about places where Montgomery County is behind the curve. That's one place where it's ahead of the curve. So good that you're doing that, and she's wonderful.
Any other questions?
Patrice?
Yes.
It's Marcia, and I just wanted to remind everyone that the reason that we have Pazit as the village coordinator is that our Commission on Aging advocated for that very strongly some years ago.
Excellent. Thank you for sharing that contact. Austin, did you have another question? Your hand's still up, or you just failed to put it down?
Just a comment about the diversity issue. Silver Spring Village has done a lot of work on that subject. And Paviv has also, there are things that are happening in that area. It's not completely a blank.
No, I think that's right. I think a lot of the villages have tried. Capitol Hill Village, which of course one of the first villages in this area, tried very hard to be very diverse and to reflect the Capitol Hill neighborhood, and it just couldn't pull it off. Gail Cohn, who I suspect many of you know, could tell you long, sad stories about how difficult that was. And it's about trust. It's about all sorts of things, but it's harder to do than we'd like to think.
I think Chuck had a question. And
yeah, Howard, if I hooking on your plan to add a small amount of to payroll taxes or whatever, but if that was hooked into a life insurance policy, and that policy could be applied to long-term care if necessary, you would be giving an ultimate benefit. They wouldn't lose the money when they died. It's not insurance of that type, like Social Security. It would be invading the final benefit of a life insurance policy to provide for long-term care. And that would be much, I think, much more appealing to legislators, and it could be privatized, which is even more appealing, because I think the insurance companies could get behind that plan that would allow that type of application prior to death.
So there are models out there that are a little bit like that already. They call them combination plans, and you can combine a long-term care insurance rider on an annuity or a whole life insurance policy. There are other people out there who have proposed the idea of having basically just a traditional term life insurance policy that we're all familiar with. And once you reach 65, it would convert to a long-term care policy. So people are talking about models like this, but the problem is the same thing. The combination products that are in the market are selling to a relatively small number of well-off people. They're not being purchased by middle-income people. People in the long-term care insurance industry always talk about the middle market and how they want to find a product that's going to attract the middle market, middle-income people, and they can't.
I don't think it's an income problem. I think the problem is young people feel that they're never going to die or never going to get sick. So, but if you create a vehicle where they must begin or take a policy like that, and at their first job, it might, in other words, get them started early when the premiums are extremely low, and let it carry through to life. I think the payment process would be less painful for sure. I mean, it's
So you said the key word, and it's the most controversial word in this whole issue, which is require them to do it. And that's what the conflict is. Do you make people buy this policy, or do you just make it available to them? And what
well,
we've
you
learned,
hook it into a Social Security situation and allow it to go from job to job. They do it with financing plans where you purchase stock. Why can't you do it with long-term care insurance? It's almost a normal process, but applying a slightly different product. That's it.
So in the interest of time, I'm going to take one more question. I believe Lily has a question, and then there's a few comments I'll highlight.
Thank you, Howard. A really good presentation. So one of the things that I'm wondering if you have any advice, particularly in my area, which is caregiver support with the county, how you're seeing some innovations that are happening on how to reach those family caregivers who are just going it alone at home. You know, any advice that you've got for us would be appreciated.
so let me start by saying, this is probably not going to be unfamiliar to you. Survey after survey shows that family caregivers don't know that they're family caregivers.
Yep.
So if you start out by saying we have a program for family caregivers, they're going to say, well, that's not me, that's somebody else. So I think the first thing we need to do is figure out a better name. Then there's the question about where they can go for help. And I think we don't do a very good job of helping people understand what's out there. So we have AAAs. JCA has a senior helpline. Almost nobody calls it because they don't know it exists. There are resources out there, but we all need to do a better job to help people understand those resources are out there. The other issue, frankly, this is sometimes unpopular to say, but I'll just put it out there. The other issue, frankly, is too many people want help for free, and it isn't free. You know, Austin was talking about can we find a way to lower taxes? You know, if you keep putting these programs on the government and you don't pay for services that are available, where's the money going to come from? It's got to come from taxes. So I think we also need to help people appreciate that the kinds of decisions that they need help to make are decisions that can cost them hundreds of thousands of dollars. I mean, literally, a nursing home is around here is $150,000 a year, and you make the wrong decision. You not only are spending an enormous amount of money maybe you didn't need to spend, but you're also putting your loved one at risk. So the idea of spending a few dollars to get advice is cheap at the price, but people don't want to pay it. They don't want to pay it either in taxes or in fees. And that means that those of us who are trying to provide those kinds of resources are doing it on a shoestring. But we need to, I think, do a lot more to recognize the value of family members who are caring for loved ones. The healthcare system doesn't appreciate it. Again, going back to the COVID experience, right? What we saw was for over a year, family caregivers were out of the lives of people who were in institutions. They couldn't visit. They were not there to keep an eye on things, to advocate, and we saw the consequences. Literally, people died. And if that didn't show us how valuable family caregiving is, I don't know what will. So now that we understand that it's valuable, what are we going to do about it? And I think there are a lot of areas where we can think about this. One of them is not just providing information to caregivers, but providing training to caregivers. I always say that the problem with family caregivers is they provide their support with great love and no skill. And the outcome of that can be pretty bad. So there needs to be more training, there needs to be more support. There's a whole range of services we need to provide. We don't think about the caregivers. We always think about the recipients of the care. We don't think about those people who are providing it, and they're critical to making the system work.
Very good point.
Thank you.
So
Music to my ears.
So there is one final comment in the chat that I did want to highlight. Not sure if Eddie wants to chime in with one more minute to devote to this line, to the questions. This is bottom line about the villages wanting to get more information about the online programming. Eddie, did you want to add
Sure.
commentary there?
Just so everyone knows, the Commission on Aging is very aware of the fact that as great a selection of services that the county offers our older adults, we really don't have good marketing of all that information. You're right, Howard, people don't know things exist or don't know who to call. And that's something that we're hoping to work more closely with the Public Information Office. And we're actually going to even advocate for getting a senior fellow along those lines. But it's something that the county has to take hold of and take some responsibility for. We need to do better marketing of our services. Not that we can't improve them and work on more, but just marketing what we have would be a big improvement. So it is something.
Absolutely. You look at the county website and you try to find senior services in one place, and you can't.
Yeah.
And where do I go for transportation? Where do I go for Meals on Wheels? Where do I go for housing? Where do I go for caregiver? And it's all over the place, and nobody's going to find it.
Yeah. Yesterday, I'm a volunteer with Montgomery County Parks, and yesterday I was talking to the parks people about what they do for the older adult population and realizing the split between the Department of Rec and the Department of Parks in the county. And so, all those things just lead to a lot of underutilized support that people could be accessing better. That's it.
So Kathleen says there's a senior site on the county website. Yeah, there is, but everything isn't on it. That's the problem. And it goes back to what I was saying before. It's very important, not just for marketing purposes, but for funding purposes, that we find ways to get these various revenue streams, these various programs, whether it's housing or whether it's transportation, all the people who are in this call, to find a way to get the system to work more closely together. And I know it's hard because everybody's got dedicated funding sources, and you're getting money from the federal government. The federal government says you can only use the money for this and you can't use it for that. I get all that, but it's really important to find a way to coordinate all of this. And from Vivian was talking about what it's like from kind of the perspective of a normal, ordinary person. It's really hard to navigate this. I'll change. It's not really hard. It's impossible to navigate. And we need to do more to make it possible.
So thank you so much, Howard Glickman, for your presentation today. We're going to go ahead in the interest of time and move on with the rest of the agenda. You are welcome to stay for the duration of the meeting, or if you have other obligations, we completely understand. But I wanted to say thank you for the wealth of information that you shared today.
Well, Dr. McGee, thank you very much. It's been a real pleasure to see all of you. And if anybody wants to talk to me, I can easily be reached. My email is just hgleckman at msn.com, and feel free to reach out to me. And thank you again for having me.
Thank you. And so I do want to go ahead and turn it over to Dr. Kroll. I think that his audio is working now, possibly, and give you time to address the group, Dr. Kroll. Go ahead.
It is working now.
Okay, great.
It is working now. I am still here. It was working out, and thanks to Mr. Blackman for a great 10,000-foot flyby and a couple of deep dives into some details around what we need to be doing for seniors and what we could be doing better. And hopefully, as we go forward, we will take some of that to heart. I'm going to do just briefly just some observations around where we are with our least favorite topic on the planet, but one that has not let us go, and that is the pandemic, of course. And we are, just to let people know that we have been looking fairly good. We have been, for many, many weeks now, we've been on this downward trend in terms of the numbers of cases of COVID that are showing up. The last, coming off the 4th of July holiday period, and in the last week or so, we have seen this gradual turn upwards again in terms of the numbers of cases. We get a daily report, Dr. Gills and I get a daily report on COVID-19, and we share with the council and everyone else. But as of this morning, there were 41 new cases in the county and 3 hospitalizations out of that. Fortunately, there were 0 new deaths. We are seeing sort of a trend upward. As I said, the challenge now is folks who are unvaccinated, largely unvaccinated cases, but there does seem to be, there's still a fairly great risk of folks who've only gotten 1 dose of the vaccine, and you all, I'm hoping you all are hearing this from various sources at this point. If they're unvaccinated and they've only gotten 1 dose, there's a much substantially greater risk. There is what I would describe as solid coverage for Moderna, Pfizer, and J&J vaccine against the newer variants, but it is not bulletproof. We are still looking at 60 to 90% efficacy, with some drop off in that, I think, for the Delta variant, which is becoming the most prominent variant in the country. There is, for comparison, the flu vaccine is about 40% efficacious. So, but it means that you can still get the flu, but it also means that you are protected against some more severe levels of influenza. Same is true for COVID, for the vaccines. You can still contract COVID, but the level of severity is lower than if you are unvaccinated. So we're hoping that folks will remain vaccinated, and will remain safe, and will get vaccinated if they're not. The other piece of this, of course, is we are having conversations with the county council, sitting as Board of Health, about whether or not we need to ramp up, consider at what point we need to ramp up restrictions if the trend upwards starts to continue. We think that most of these, even in Maryland now, in Montgomery County, it looks like the Delta variant is accounting for most of the new positive cases. So it is, it's a cautionary tale for us. And it is, Dr. Gales is asking the Board of Health to consider when or where we want to up the mask requirements and or any other kinds of restrictions they might want to put in place. My message to county employees and to this group today is, I would not presume that because you're vaccinated that you can doff your masks and go off and have a great time any place you can. I would advise caution, especially if you're in indoor gatherings with large groups of people, or outdoor gatherings even with large groups of people. I think this group has probably done a reasonably, an excellent job of staying on top of that, and so I don't think I need to belabor that point. We are, is there anything else on this? We are, as a department, Health and Human Services, along with much of the rest of the county, has now reopened most of its offices, all of its offices to some degree. There is, we never really shut down. We moved online and virtual for most of our work. But now we've got people back in our offices at least several days a week, each week, to deal with the service needs of people who don't have digital access, or for whom digital access is more of a challenge. So it is us slowly coming back into the offices in a very measured way, being mindful to keep a look over our shoulders at this virus and what it's doing. I think the other pieces of this, a couple of things that our presenter talked about that resonated for me. One of them was was just the difficulty in navigation. And navigating services in this county can be a challenge for anybody. For the department, we're working now and resuming work on trying to create a more navigable system so that people can call us and get to a person and get the help that they need and get routed to the right service, to the right department, to the right program to get the help that they need without having a lot of to do a lot of hunt and peck. The comment about the county website struck close to home. I know looking at the website for HHS, it is sometimes difficult to figure out where to go to get what you need. So one of the things on my radar this year is to try and get back, is to try to address at least the HHS website to make that more navigable. I think we are, as part of our recovery effort, we're focused on a series of things across the county. The number one right now is rental assistance for folks who've suffered some income losses and whose support systems are not where they need to be, to try to make sure that they can stay in their homes and we prevent them from having to go through the drama of having an eviction writ filed against them if possible, but certainly to prevent them from being evicted in all cases as much as possible. I'm thinking I'm going to pause there and see if there are any questions or any comments that the folks want to make, and happy to take any questions. Otherwise, I'll turn it back over to you, Patrice, and you can move forward with your agenda. And I will end by adding associating myself with the remarks that have been made regarding Pazit. She is truly a treasure in the county and in the department. And I'm happy to have her to be part of the staff at HHS. So with that, I will pause.
Absolutely. Any questions for Dr. Krall? I don't see any hands up. All right. Well, thank you for that wonderful update, and we're going to move on with the agenda. So as previously stated, I am filling in for Odile Brunetto, Dr. Odile Brunetto, our Chief of A&D. I am Dr. Patrice McGee, the Director of the Area Agency on Aging. So I am going to lead with her report. Just want to highlight a few things. The fiscal year 22 budget for A&D, we have one new social worker position, a conversion of 10 broker contractors to merit county employees, and a 3% increase to county funded contracts. For HHS, there's a creation of an HHS call center, creation of a homeless court docket, increase of a crisis center mobile team by 6 positions, and increased funding for the 8 service hubs, and increased shelter capacity year round. For the Office of Community Partnerships, there's a creation of a new translation unit with 13 positions. For the Department of Transportation, they're going to provide free ride-on and Metro bus services 24/7 to seniors and persons with disabilities. And for the Rec Department, there's an increased budget for senior activities by $250,000. So very thankful for the approved budget and looking forward to the growth in those areas. Dr. Krall provided a very thorough update of the COVID vaccination efforts, where we are in the county with that. For the latest stats on vaccinations, please visit the county website. I was in a meeting this morning where it was reported that I believe, make sure I give you the correct percentages, 95% of 85 and older are vaccinated and 85% of 65 and older are vaccinated. So for the latest stats, again, please visit the county website. Also, Dr. Krall mentioned the reopening efforts. So as far as the Area Agency on Aging, what's happening within A&D, wanted to highlight a few of the programs and where we are with that. So the ADRU currently is undergoing a shift in their referrals for APS. The state has initiated a state IVR hotline for all CPS and APS calls. So the ADRU, the Aging and Disability Resource Unit, was provided with a script to redirect all calls between the hours of 8:30 and 5 to the new state IVR that went live on July 14th. So after hours, after 5 p.m., the crisis center will be taking those CPS and APS calls. In addition, the long-term care ombudsman program, they will return to facility visits, in-person indoor facility visits in May. So the entire team at this point has resumed face-to-face visits in facilities. I think it's important to share with this group and note that as a result of COVID, we have lost half of our volunteer base in the long-term care ombudsman program. But we did hold our first in-person volunteer training this past week. So the few volunteers that we have remaining, they are invigorated and ready to return to service. Our AIRS program, the Adult Evaluation and Referral Services, has now been renamed the Community Evaluation and Referral Services, as that assessment team evaluates from birth to death. So changing the name to community was inclusive of the total population in which they serve. As of August 16th, they will resume, the SARES program will resume face-to-face in-home assessments as per mandated by the state, with the state federal, the state of emergency, tongue twister, the state of emergency from the state was lifted, and as a result, they will return to in-person assessments. So we are preparing for our staff to go back in people's homes following the guidance of the county's PPE requirements, as well as MDH guidance, Maryland Department of Health guidance. And then our CFC program, our Community First Choice program, is a federally funded program. So they will return to in-person face-to-face client visits once the federal state of emergency is lifted. I think it is important to note that to Dr. Crowell's point, there is representation as of July 12th of all of the programs within A&D in the buildings. So staff have returned to the buildings, are on various schedules as to when they are in the building, but there is program representation weekly as a result of the county's July 12th opening. Also wanted to make mention of a telehealth focus group and survey program project that a small group within the AAA has been undertaking since May. So we're really looking at Montgomery County as a whole among older adults and their usage of telehealth, wanting to identify any benefits or challenges that older adults are experiencing. So we launched 2 efforts to gather this information through surveying and through focus groups. The first duration of this, there was mainly white respondents. We had very little diverse inclusion in both the surveying and the focus groups. So we've launched an additional effort with the health initiatives and the health programs through the county to have more focused groups that will be inclusive. We've translated, the surveys into various languages, and we are operating focus groups as of tomorrow. It's our first in-person Spanish, I believe, focus group that's going to be held at Holiday Park. So in an effort to get more inclusion in our results, we are being very strategic in trying to reach those diverse groups. And to the point that Lily raised earlier, thank you, Vivian, for your support with that. The hope is that we can, again, highlight the benefits and the challenges and make strong recommendations to improve telehealth throughout the county among older adults. So then I think I saw Sean on. Sean, if you could highlight the COA, Commission on Aging, give us an update on that really quickly, and then that will conclude my A&D report.
Sure. Eddie Rivas is here as well. He's the vice chair of the Commission on Aging. But I will just say that they're going to hold an exciting budget discussion. It's quite a process to figure out what the commission's budget priority is going to be each year, and that's going to happen tomorrow. Eddie, do you want to add anything?
I guess I would only add that be aware that we're trying to get the feedback from all the commissioners on the budget process, same as we did a strategic planning process last week. I shouldn't call it a process, a strategic planning listening session. These are listening sessions, so that all commissioners have a say and are clear that this is the opportunity to speak. I've alluded to some of the other things that we're working on. We're always available and look forward to people attending our meetings on the third Thursday of the month. Is that right, Sean? Sorry. But yeah, no, you guys have a full agenda. We don't need to belabor it. Marcia wants to say something.
Okay, Marcia, yes, go ahead.
I just wanted to add that the commission, in light of some of the things we've talked about today, the commission also has recently reestablished, after a long hiatus, its communications committee, and is going to be working with Mary Anderson and all parts of the government, I hope, and to try to do a better job of getting a handle around how to better promote both the commission's work, but more important than the commission is the services and programs of the county. So that's a wonderful new effort that the commission has just launched again this year after many years of not really having an effective committee.
Excellent. Thank you, Marcia. And just wanted to go back to some of the comments in the chat. Lily has dropped information in the chat about the support groups and the telehealth support group and focus group, as well as someone asked specifically about an IVR. It's an interactive voice response. So it'll be a system that's capturing the data on the specific APS call or CPS call the state is wanting to gather more data on. There will be live interaction on the line, but they'll also have that IVR component to it. Any other questions? Okay, then we are going to move on to committee reports. So we will start with civic and social involvement.
Hi there, Kathleen Stobie here from the Volunteer Center. I'm co-chair along with Vivian on civic and social involvement. I just wanted to invite everyone to a very exciting premiere tomorrow night. The Montgomery Serves Awards will be premiered at 6 p.m. After I finish speaking, I'll drop the link in the chat box. We'd like to invite everyone to come and see the incredible winners of awards, including our wonderful Neil Potter Path of Achievement Award winners, Nancy Aldis and Dolores Cole. And I thank Stuart from the Beacon, who helped support this endeavor. And he also appears in this video, so you have to tune in for that. And also to the Commission on Aging, who provided judges for the Neil Potter Path of Achievement. Although we are very saddened that we lost one of our judges this year, Miriam Kelty, and we were able to put in an in memoriam page into the program at the end, which I was very happy about. The other thing is the Montgomery County Volunteer Center has just put out its impact report for fiscal year 21, and I will drop that link as well. We have a flip page book, and we also have a back and front 2-pager quick one, and it's the most visually stimulating one we've ever done, so we're very proud of it. And Vivian, if you have anything to report, please step in because I'm done. And also Austin, if Austin has anything to say, we always stop to hear what Austin has to say.
The only thing that I want to say is that we have found a new way of combating isolation for the seniors. In the past years, during the summer, because of the summer camp, there is no activity for the seniors. But this year, what we have done is that we have get the seniors to the parks. Okay, and then we do exercise, walking, and so forth from like 10 to 12. Okay, and it has been really, really successful. So I think that maybe something like that could be do the same thing with other senior group as well in the future. That's all I have.
Any questions for Kathleen or Vivian?
I can add one comment, Kathleen. I think we're very pleased, I think, to see all the work that is being done on the internet from Senior Planet and Mitzi Herrera's work. Extending broadband is going to be continues to be important, but there's been a phenomenal growth, it seems to me, in opportunities through the Senior Planet contract that the county has. Thank you.
Excellent, thank you. Okay, we're gonna move on to communications and outreach.
Okay, as you all know, we have the monthly full page in the Beacon on age-friendly topics that we're getting from each of the departments. For August, we're all set and ready to go with home and community-based care, thanks to Lily. September is going to be on health and wellness and fall prevention, and we're just waiting for a few little updates on the fall prevention programs from the Recreation Department on that. October is about employment, and Mara, you let us know if you have any updates to make before we finalize that ad. I know that the JCA Employment Expo has now scheduled its dates for the fall, so I thought we might want to include those in there. So let me know. November is Jim Resnick working on public safety, as I understand that. I'm looking forward to getting that information from him. And for December, we actually don't have a current topic area assigned. So if anybody has any good ideas for what might be good December content, I was thinking perhaps something about help for low-income residents, food for the holidays, something like that, or just those who are alone for the holidays, something along those lines. But give us either contact me or Marcia with some suggestions. We'd appreciate it. Other than that, the Beacon, as I mentioned last time, we're going to be having again a virtual expo, and I now have our keynote speaker for that is going to be Diane Rehm from NPR. And we're also going to have an in-person expo at Montgomery Mall. So we're very excited about that. We haven't finalized our speaker yet for that. And last of all, the cover story for August is going to be about Maryland Senior Olympics. So that's very exciting as well. Now that's all I have. I don't know what else is going on from the Public Information Office, but I haven't been given a report from them. So that's where I am. Any questions? Okay, great.
Okay, Kathleen, you said something about an award. Did you want to? Oh, no, okay. I was able to pop out and see what you're talking about there. Okay, so we're going to move on to elder abuse prevention. Is someone on from that committee? No? Okay, employment.
Okay, I'm here. I should tell you, because this relates to employment as well, that Cynthia Grissom, who's co-chair, is not on today because she's in an important training program, and they happen to have something going in at this very minute. But I will tell you, there are changes going on at Services-Montgomery, where she works. The job centers, which have been run by a company where they contracted out, they're now going to bring running those job centers within Services-Montgomery. So as of June 30th, the contract with the current grantee has ended, and meanwhile, they are literally hiring and onboarding 20 staff members. So they are very busy, but it should make a really good difference because they will have a level of direct involvement in the job centers that should be good for everyone. Cynthia reports that the Wheaton office is open to job seekers. The Germantown office is under renovation, so not yet. but they hope to have everyone trained and business as usual by probably early September, maybe even a little bit earlier than that. And they are also developing a new online system to process and house data so that things can be more efficient. So there are changes in Services-Montgomery. It's crazy to manage it, but they're doing it, and it should really help for those who are seeking jobs. The other thing I just want to mention is that on June 23rd, with help from our work group, Jim Stowe and the Office of Human Rights had I think it was a 4-hour online session, the topic of which was capitalizing on the new hybrid workplace, intergenerational, flexible, and responsive. And they had speakers on each of those topics. And I don't have the list in front of me of the names, but they were really leading people from Holy Cross, high up people at Marriott, and other companies that are Montgomery County based. And not only were the comments really informative and helpful for all sorts of both job seekers and also employers, but the intention that Jim has is to put copies of the recordings on his website. They're not there yet, and I need to check with him when they will be going up, but they can be then sort of cut into pieces, and you could use pieces for different presentations in groups that you're interested in. So they were great speakers. It was, when I tell you that 3 or 4 hours was great, believe me, that's pushing it. But they really were. And so it will all be available for future use. And we are hoping as a committee to be able to encourage the use of it in companies, because the goal is to get the employers more open to the 50+ hiring. That's it for the moment.
Thank you for that report out. Any questions, Mara? Okay, so we're going to move on to health and wellness. I co-chair health and wellness with Sarah Suarez. Sarah was not able to join this meeting today, so I will provide a brief overview of our last meeting, which was held on June 15th. It was a brief meeting. We did have a speaker present from the county libraries. Otilde Pratalif spoke about what to expect with reopenings for the libraries, and briefed the group on the different iterations that had taken place with all the changes that was occurring around the time of reopening, as well as Sarah provided an update on the rec department and what they were anticipating with senior centers as well as summer camps. So we are seeking speakers for seeking speakers for our next meeting, either on social isolation or falls prevention. So that's what we will be focusing on for our next meeting. All right, so we're going to move on to home and community-based services.
Thank you. The Home and Community-Based Services group is focusing this year on the areas of workforce development. And on July the 16th, we hosted our second round table. These are invitation-only meetings where we are bringing together public-private partners specifically to look at such issues as training, workforce recruitment, pipeline, retention. This last meeting, we were fortunate to have Council Member Albanos attend, and these meetings are convened by the Chair of the Commission on Aging, Barbara Selter. And we're fortunate to also be partnering with the Maryland Region Direct Services Collaborative. So some of the takeaways from this round table have really been pretty milestone. We have really started to look at what are our action items moving forward. And a big one is the cooperation between the training pipeline. So that includes Montgomery County Public Schools, Montgomery College, say, for example, Jess's Senior Community Service Employment Program, and WorkSource Montgomery is also part of these discussions. So we're looking at how the service providers of the training then can be in better coordination with the businesses that actually are the ones that employ the aides, and then the community users of that process. So we are exploring hosting 2 pilot projects, and the goal of these 2 pilot projects is to both increase the utilization of older adults who are participating and want to be employed, but maybe not necessarily want to take on the full certified nursing assistant or home health aide training, but are really interested in being employed within people's homes as a friendly visitor, maybe assisting with light housekeeping and that sort of thing. Then the pipeline with the younger person through Montgomery County Public Schools and Montgomery College on how can we both increase the awareness of what the needs of older adults are and the people who are at home providing care for them, and how to engage younger people to actually see that this is an industry and a career that they could consider entering. Great team of people who are working on this, and our next roundtable is due in October, and probably after that, early next year, we'll have a panel discussion and putting forward recommendations both to industry providers and Montgomery County government. I want to acknowledge also the participation of many members of this group and also our minority health initiatives to ensure that we have very strong diversity in this conversation. Thank you.
Thank you, Lily, for that report. I will echo and say that I did have an opportunity to join that roundtable discussion, and it was a very robust and rich discussion. A lot of great points were raised, in addition to some of what Dr. Howard Glickman raised during his presentation with in-home care and the shift that that's taking. So thank you for the work that you're doing there, Lily. So we're going to move on to housing.
Yes, hi, this is Lorraine Driscoll. Thank you, and good afternoon, everybody. I want to start out by thanking everybody for talking about communications. That's something housing's focusing on right now, amidst other things. We're very much in the midst of upgrading the website. We're up to our elbows, and it will start happening iteratively. And as part of that, we're going to update this page on the senior site, which is job 1. But anyway, that we're going to looking at plain language and really organizing things and trying to make it much more accessible. So, I think over the next 6 months, people will start seeing that getting implemented. We're working continue rental marketplace. That'll be on the senior page soon on the housing site, and just looking, at continuing quality control and really making sure that that rental marketplace is the best it can be with the data we have. I mean, it's just a representation of rental survey data from multifamily apartment building properties, but making it the best we can make it, and then do a big launch. So we're just still doing a little quality control, but it is up and running. It is on the DHC website. And we're also continuing to support HHS as the HHS is the lead on rent relief and eviction prevention. And we are continue to work with the support organizations on eviction prevention and we're still distributing flyers to the food distribution sites and community outreach, social media, trying to reach more people. I just heard that we had heard that the State Department of Housing was going to send a postcard to renters to make sure they knew about rent relief. And we just heard that those are dropping. So that's helpful that, people who just hadn't heard about an option who were really affected. This is only people affected by COVID. Additionally, I wanted to say that have to acknowledge that Leslie Marks is probably in Ohio by now, and we miss her a ton. But now that she has cycled over, I'm working with Marcia to figure out how to get a housing work group really going. So if anybody's interested, this is brand new for me, but if anyone's interested in that, please let me know. We're starting to figure out how to make that work. So that's it.
Thank you, Lorraine. Any questions, Lorraine? Okay, we're going to move on to planning, open spaces, parks, and community buildings. You don't have a representative from that committee? Okay, so we're going to move on to senior public safety.
Hello. Hi, it's Tracy. I'm not sure who else is on from my group, but I'm from Consumer Protection. And, we did, I can't remember if we've already done this, but we did a bunch of WEAD programs with our public safety group last month. And we did one with Mario's group who hosted us for World Elders Abuse Awareness Day. We did one with ElderSafe. And I and Marcia and Jim Resnick are going to be interviewed Friday for Seniors Today. So that's exciting. And I think I had mentioned, or I had asked folks on the Public Safety Committee to mention at our last meeting that one of our 3-year goals is to update the public safety web pages, but we cannot touch our pages unless the entirety of the senior web pages are touched, and because they all have to look the same, feel the same, sound the same. So at some point, this group needs to maybe come up with a subgroup of some kind to try and address that. Otherwise, we will fail in that one goal for our 3-year plan. So I don't know what the next step would be, who to ask for this subgroup and what to do next. But that was something I think Jim raised on my behalf because I didn't make the whole meeting last month. So if either Jim or Stacy are on, they could talk about fire, emergency, and police.
This Jim is on. It says
Hello.
Beth Ann. I keep changing names and it keeps on not being my name. This is Jim Resnick from Fire and Rescue. Thank you, Tracy, for that report. And yeah, we are all in agreement within public safety what Tracy is saying about the need for the rest of the age-friendly group to move along with those reporting. Very quickly from the fire end of things, I'm looking forward to joining Tracy and others this Friday for the Seniors Today, or if I'm not sure if it has a new name or not. Unfortunately, when I started out this call, I was on my cell phone because I was at the site of, unfortunately, a fatal fire involving a senior in Montgomery County in the Bethesda area. This was, the investigators are still working through some of this information, but it appears as though there were no working smoke alarms in a rental property. So it touches on housing, it touches on so many of the aspects of what we're working on in this group. and a very, very sad, unfortunate situation. More to come on that. I'll share whatever I can, and you might want to check the MCFRS Twitter to find out any more about that. We've been very busy otherwise, starting to do more and more outreach. We're not yet allowed to go into people's homes to do individual home safety checks, but we anticipate that that is going to be changing fairly soon. Continuing to do Zoom presentations for various communities. Just on a personal level, the communities that I'm touching, I'm able to get to and do these Zoom presentations in many, many, many cases are just like me looking in the mirror. And by that, I mean, it's older, white, Jewish people. And we're struggling to get out into the rest of the community who absolutely, we recognize that there is a need for fire safety education to everybody in this community. So I implore any of you who have any ways to help us get out to more diverse communities to please get in touch with me. Let me know what we can do. What we can do to shake the trees, shake hands, and get out there to do that stuff. So that's kind of it from Fire Rescue for right now. Like the rest of the group, I'll take any questions if anyone has, but otherwise I'm going to pass to my the other Jim McClellan from Emergency Management and Homeland Security.
And Stacy's on too, I think.
And Stacy.
Thank you, other Jim. I've got nothing to add at this time from emergency management, so I'm going to pass off to Stacy.
Hello, everybody. I also unfortunately don't have anything to add, but I'm very much enjoying the call and learning all that I can. And I'm very sorry to hear about the fatal fire down in Bethesda. That's awful.
One last thing, the county fair is go, and at this time we will have a small footprint from fire rescue, community safety education out there. It'll be limited hours that we're there, but we will be there probably every day of the fair. So maybe looking forward to seeing some smiling faces under masks.
Thank you for that very thorough report. And again, to echo Stacy, very sorry to hear about that fatality. So thank you again for sharing that. We're going to move on to transportation and mobility.
Hi, just a few updates from DOT. With regards to ride-on buses, we are still providing free fares, at least through the end of September. Currently, all our safety measures are still in place. We are cleaning the buses twice each day with hospital-grade disinfectants. The air and ventilation systems are all treated at night. We still require masks for people who are using the service. We have stocked up the buses with masks for people who don't have theirs. So pretty much all the safety measures are currently in place. And I should also add that during periods of extreme heat, we are stocking the buses with free water bottles so that people can dehydrate and stay safe. Additionally, we just recently ended our vaccination shuttle, and that shuttle transported people from the Shady Grove station to the mass vaccination site at Montgomery College campus. So we ended that on July 2nd when the site closed. Was really successful, transported on the average 350 people each month since March to that site and back. So we're very, very happy about the outcomes of that. Now, regarding our service, our full service, we continue to monitor the service as riders keep coming back to use the bus post, as the conditions are reopening. And we are adjusting schedules to some levels that are not quite similar to pre-COVID, but making adjustments as we see fit. So the planners will continue to monitor ridership for each and every route, take on-time performance feedback from the public, identify routes that could achieve more efficiency, and just either increase the frequency of the buses, or deploy what we call strategics, which basically pick up the routes when buses are full. So those are all being monitored. And recently on July 18th, we implemented a service change. And based on those observations, just to continue to improve service and be more efficient to serve people as they keep coming back and using our service, we've absolutely seen an increase in ridership since the reopening. And we want to be able to accommodate those riders as they come in to use our system. One of our premier services, on-demand transit service called the Flex. It serves the Rockville defined zones, also serves Glenmont and Wheaton. We also resumed operation with that this past July 19th. So services are still free even on that one. This is on demand where people can book using their apps. We now have a call center where they can also call for people who don't have smartphones to schedule these trips within those defined zones. For this group, most importantly, seniors will be riding free, even when we start collecting fares on all ride-on buses. And effective July 1st, seniors can ride free on all ride-on buses in Montgomery County. So that's in effect now. We've been doing our best to get the word out there. So metro buses in the county obviously are charging fares, but seniors and people with disabilities can ride free on those buses as it moves on. So a few things, updates I've given in the past, and I just want to touch briefly on those. We finalized the contract with the Council of Government for our travel training bus. This was a grant of close to $700,000 to purchase a dedicated bus that teaches seniors and people with disabilities how to navigate the public transportation system. So that's moving along. We hope to have a program in place. I mean, we do have a program in place, but this helps us enhance the program. So that's what we're looking forward to. We continue on the 3 studies I mentioned previously that we're doing on Ride-On. This is the Reimagining Ride-On study. We're taking a look at the whole system, top to bottom, every component of it, to see ways that we can improve service, enhance service. There'll be outreach along those lines to get feedback from the community. So we'll be scheduling public forums in different parts of the county to hear from residents about things and ways we can implement the service to better serve their needs. So that's going on. We're also doing a fair equity study, which will be due to the county council sometime in September. We're examining different scenarios. The first will be to possibly make fares free all the time for everybody. The second will be to do it on an income basis. Qualify people with low income to ride free all the time. The third will be to reduce the cost of the fare. We currently charge $2 when we resume fare collection, maybe split that into 2 and make it $1. So we have a consultant looking at best practices from other jurisdictions who have implemented free fares and see ways that those could be kind of transferred here. But it will be a decision by the council and the executive after the study is over. Additionally, we're looking at safety and training processes within Ride-On as well. That's another study going on. And Sean is here. I think she will talk about Transportation Services Improvement Fund, which we are now trying to engage the Commission on People with Disabilities and Commission on Aging to provide feedback and just kind of partner with us on the best ways to utilize those funds, which are dedicated to improve transportation services for older adults, people with disabilities, and low-income residents. So I'll let Sean take that away.
Thanks, Sam. That was a lot. World of transportation is a busy one. I just wanted to, I think you've mentioned the Transportation Services Improvement Fund. I'm just really pleased that the Department of Transportation with Sam right there at the helm as far as this issue is concerned, making sure that the feedback is heard from the Commission on People with Disabilities and the Commission on Aging, and their comments may be different, and that's okay, you know. So there's a meeting at 5 o'clock with the Commission on People with Disabilities that I'll jump on. You know, just wanted to say quickly, during the pandemic, the system that we've created here in Montgomery County with having Connect a Ride doing individual mobility management and information and referral, and with having all the volunteer providers of transportation, as well as the taxi companies, really worked well. So we were able to get most people rides through existing programs, but then some folks who needed transportation, we were able to use some funding that normally went to taking people to community centers. We use that funding to pay for free taxi. And we are occasionally getting a few people still who need that transportation to get vaccines. So that was, you know, kind of a quiet success that was happening behind the scenes. The last thing I just want to mention, I'm wondering if Nicole is still on. Nicole Charles is brand new executive director. She maybe had to jump off, but she introduced herself at the very beginning. And I'm thrilled with her, the addition to the Senior Connection. You know, the Senior Connection is the largest provider of volunteer transportation to older adults in the county. And she's bringing a lot of experience and energy to the role. Nicole, are you here or? Okay.
It doesn't look like she's still on, Sean.
Okay, so I just encourage folks, she may be reaching out to some of you. She's very interested in getting to know folks. She's from New York, moving here soon, and I hope everyone will welcome her and think creatively. I think she's got a lot of vision for the organization. So thank you.
Excellent, thank you. I'll report out. So in our last 10 minutes, I do want to ask if there's any announcements, additional announcements from the group. Marcia, yeah.
I just want to tell everybody about what Age Friendly in general, the program is doing. Many of you have heard this already, that we had a big program in May with the DC Age Friendly and George Washington University Center for Aging, Health and Humanities, and 5 other local jurisdictions to discuss, and we had a number of regional leaders. Well, first of all, we had Mayor Bowser and our own county executive participate or send greetings anyway. And then we had very high up regional leaders on a variety of topics. And then we had regional presentations in which Montgomery County participated. It was really effective. And the outshoot of that is that A, it's going to be an annual event. And B, they're having some kind of program in October, and I don't have the details yet, but I will inform you of sort of creative thinking about what was heard and trying to come up with innovative projects, ideas for projects coming out of that. So it should be really interesting. We will be participating in that. We will be participating. Kathleen, I don't know if Kathleen, you're still on. Would you like to tell them what we are participating in a program with AARP in September, and Kathleen is leading the ranks on that. Kathleen, would you like to tell them what you're doing?
I'm here, I'm listening. Yes, I just spoke with Joy Hall at AARP this morning about this livability conference that they are planning for September. And they said, as of now, there wasn't too much to tell. I did register on behalf of Montgomery County, so I'm in the loop. And I don't believe registration is open to the public yet, but it will be on September 22nd and September 23rd. So it's engaging older adults. And as I learn more, I will certainly share it with Marcia, who is always so good about sharing everything with everyone else. So that's all I know at this point.
And the topic is about the importance of engaging older people in
Correct.
life. That is the thrust of the event. So that's all. I'm done.
Okay. Last call for announcements, additional announcements. Okay, so I do want to ask Dr. Crowell or Robin, Riley, any last thoughts you want to add here?
No,
Actually, Dr. McGee,
Yes.
kudos to you for running a great meeting.
yes,
Oh, well,
I
thank
agree.
you.
Neil has met her match.
Yes.
Thank you.
I agree. I just want to thank Marcia. She's always so helpful. So appreciate all her work. No, that's it. Thanks, everybody. Thanks for joining us. It was a great meeting.
Thank you.
Lots of
Yes,
great
and I do want to
information.
let you know that, I'm sorry, Robin, was you still speaking?
No, just great information today.
Just wanted to let you know our next meeting is scheduled for October 20th from 3 to 5 p.m. So be on the lookout for that meeting invite and give you 7 minutes back to the end of your day. Have a
Bye,
good
everyone.
afternoon, everyone.
Bye,
Take
everybody.
care, everybody.
Bye.
Thank you.
Bye-bye.